This is People's Forum.
Thank you for staying here at 92.5 Enugu's Dream FM. Good evening and welcome to the midweek edition of People's Forum. Yes, today is the 15th of July 2020. Time in the studio is 5:04 p.m. My name is Ezinan and we're alongside my production crew led by OK Odogu. And of course, like we've been doing for the past 2 Wednesdays, follow the money. What money? COVID-19, to ensure that accountability, transparency, which are parts of the ingredients of democracy, are well assured. Today we want to focus on COVID-19 and Nigeria's underfunded healthcare system. Why? If you recall, last month, June precisely, stakeholders in the health sector were given hard knocks on the federal government for the reduction of the 2020 health budget by over 50%. Now, that is something that a lot of people are still wondering if underfunding is the major issue for the healthcare, the failure of the healthcare systems in Nigeria, or if we have other issues that we need to also look at. Let me introduce the people who are here to talk about the program or the topic today on the program. The Southeast Lead, Follow the Money, and this program is brought to you by Connected Development with support from Oxfam Nigeria. Thank you for joining us, Dr. Daniel Ugo. Good evening.
Yeah, good evening, Ezine. Good evening, our listeners.
We also have here with us in the studio Mrs. Amaka Nweke, Country Program Director of Global Society for Anti-Corruption, GSAC. Welcome. Good evening.
Thank you, Ezine. Good evening, our listeners.
And last but not the least, Ikenna Ugu is here. I'm wondering if you're both brothers.
Not exactly.
Okay, but then such as coincidence. Ikenna Ugu is a steering committee chairman, Follow the Money, Enugu State Chapter. Welcome. Good evening.
Good evening, Ezine. Good evening, listeners. Good to be here.
All right, like I said earlier during the introduction, Dr. Daniel Ugu, the question has always been, is it about underfunding or is it about mismanagement in the healthcare sector?
Actually, in Nigeria healthcare sector, I think one problem that has stood out is actually the problem of underfunding. Our health sector or our healthcare system has been grossly underfunded. In 2001, the African Union actually came to Abuja, and the heads of government actually agreed that they would mark out about 15% of their budget, national budget, consolidated fund, and designate it for the health sector. And Nigeria, up to this year, 2020, has not even been able to. Nigeria has been. Our budget has always been below 10%. I think the maximum has actually been around 5%, and that is actually considering international standard and what is obtainable in other countries like Ghana and all of that. That shows that our health sector is actually grossly underfunded, and that's why you can actually see the evidence in most of our health facilities around the countries, whether it's in the rural communities or in the urban areas, whether those ones owned by the federal government or the state government. You can see the state, many of them are in very dilapidated conditions, with poor facilities and unmotivated workforce and all of that. And also there's also the issue of corruption. Corruption is a Nigerian thing, where funds, appropriated for a given project or purpose are being mismanaged, and in some cases they are being siphoned and stolen, and even the mega resources that is available for developing the health sector end up not actually getting to be used for the intended purposes. So it's a two-way thing, both underfunding and mismanagement of funds.
Underfunding, mismanagement. Mrs. Amaka Nweke, which way are you going? Which outweighs the other for you?
Yeah, I'm going for misuse of money, mismanagement of money.
Okay.
Because let's assume, okay, the healthcare, health system is being underfunded. What have before complaining or before requesting for more funds? So what happens to the one we have at hand? Okay, like this year's budget, we now saw that it was cut down by almost 50%. Okay, like the previous budget, 44 point something billion naira was budgeted like last year. See the way our health system has been all through last year, when we even have about 44 something billion naira for our health system. This health system is nothing to write home about. So what happens now that the fund has been cut by 50%? It will be worse. Last year there was nothing to write home about our health system. Then this year COVID-19 came and exposed how bad, how dilapidated our health system is. So the problem we have is those people managing the fund. They are the ones we have at hand. What are they doing with it? Knowing that we are underfunded, why are people still embezzling the one we have? Why are they still not making use of that particular one we have at hand? That is the question. The same thing will happen even if they are given 100% or even 200%. The same thing that is happening right now will still happen. So the problem is the people. The problem is our leaders. Those are the helm of affairs. Those managing this fund. Those disbursing this fund to the healthcare system. They are the problem we have. What are they doing with the money?
Mr. Enugu, what are your thoughts?
I'd like to strike a balance.
Go ahead.
Doc went with the being poorly funded. Mr. Maka went with mismanagement.
I went 2 ways anyway.
Okay. I like to strike a balance. You see, it doesn't matter how much budget we have. The state government budget, at this time around, they called it the budget of responsible governance. I think we need to get more responsible with fund. Let's keep talking about the amount aside. You see, if you work in the field, forget about the news on TV, newspapers, get to the field, see what these facilities are like. Then you understand that even though you have this amount of money budgeted, yes, underfunded as we have it, but then we still have the facilities there. Nobody cares about this. Easy, I saw things for myself. I think last month or thereabout.
Where precisely?
I was in Ibetiti. I worked with a coalition where we worked for the Clean Water Rights campaign organized by the Whole Spring NG. We had to see for ourselves what the health facilities looked like in communities around Enugu. I covered Nsukka, I covered Ibetiti. What I found there, these stories, you shouldn't hear them. Yes, okay, you have a hospital, a health center, where, okay, you have the wash facilities there. There's no water anywhere. Everything is dry. That doesn't make any sense, because I went somewhere, the woman told me, my brother, they've been coming here. She don't even have water to wash her own hands. And you're talking about COVID, and you're asking us to wash our hands. That's how we can fight the coronavirus. So
are you saying that they are not properly trained and they don't have the necessary facilities in the rural areas?
When they are poorly funded, how can... In fact, one of the places I went, they told me that they don't even... The nose mask you wear, they don't have. The health workers, they don't have. At other places, the doctor told me that he had to buy for the staff from his pocket, not from the government money. So underfunding, yes. Management, again. So we have to put the two together.
And also, let's
Dr.
not
Daniel.
also forget that the National Health Act, actually, which took effect, I think, from 2014 or thereabout, or it got implemented in 2018, made provision for the basic health care provision fund. And actually, this fund is actually 1% of the total budget, and marked specifically for service delivery at PHCs, which is the primary health centers in the 774 local governments across the federation, because we have these primary health centers there. So, but looking at the revised 2020 budget, you realize that that particular fund was revised downwards by about 42.7%, down to about 20-something billion. And looking at the condition, these people have been in the field, and even without being in the field, me and you, I think some of us can't even comfortably access the primary health centers around us or in our communities, because they don't look like hospitals. And this fund, why the government created this basic primary health care provision fund, is actually to see that these primary health care centers are actually properly equipped, and people can be able to have access, and access to health care at a very affordable price. It's even meant to be free, But the thing there is that with the amount of the challenge in the primary health care sector, the demand, you can imagine a country where one doctor is to about 5,000 people. That is unacceptable. If what I read in the papers is correct, a doctor to 5,000 of the population.
Well, we've been having the challenge of brain drain.
Yes, because even the healthcare workers are not being properly taken care of.
All right, we'll look further. We'll look further.
And this also has to do with funding.
We need to go on a quick break.
So we must prioritize our health sector.
Exactly.
I want to say
when
something.
we come back from the break, we'll continue. I know you're very passionate to talk about other issues as they unfold. We're looking at COVID-19 and Nigeria's underfunded healthcare system on People's Forum. Stay with us.
Many things they happen, if you don't know, you go just suffer. Many things they happen, if you don't know, you go just cry. Some community they don't get the water. Some community they don't get the school. Some community they don't marry. And that is why we follow the money. That is why we follow the money. Join us now, making us. Make me follow the money. Join us now, making us. Make me follow the money. Oh yeah. Follow the money. Follow the money. Follow the money. Follow the money.
What is it with our politicians today? Nobody is making any sense.
Now only politicians, even we never show us this money.
But you don't
have good jobs. How can you?
Your views, your thoughts, your perspective. This is People's Forum.
Thank you for staying with us on People's Forum. It's 92.5 Enugu's Dream FM. Time in the studio is 5:18 p.m. We have been looking or beaming our searchlight on COVID-19 and Nigeria's underfunded healthcare system. Now, it's not news that since last month, as I said earlier, that the budget was cut. That's the one earmarked for health was cut from 44.4 billion naira to 25.5 billion naira, a decrease of more than 42.5%, and it's a far cry from the 15% agreement had to, of course, make sure that Exactly. Africa, yes. So that's actually a concern. And before we went on the break, we had two divergent views, whether underfunding is the major issue facing the healthcare system in Nigeria, or lack of management, corruption, misappropriation, or lack of transparency, and the rest of it. We have Dr. Daniel Ugu, Southeast Lead, Follow the Money. Mrs. Amaka Nweke is here, Country Program Director, Global Society for Anti-Corruption, GSAC. Ikenna Ugu is here as well, Steering Committee Chairman, Follow the Money, Enugu State Chapter. And yes, this program is brought to you by Connected Development with support from Oxfam Nigeria. Before we went to the break, let me, ladies first, or lady first. Go ahead.
You know that the primary health care center is the first point of contact for those in the community. That is where they have access to health care before you talk about coming to the town, maybe to access health care from the secondary or the tertiary. Do you understand? So because of this reason, our leaders, they don't have any business with the primary health care system. So that's why they will have the mind, instead of improving it, they are now cutting down the budget, because none of them will come to the community to access the health care. So it is for those vulnerable people, for the poor masses in the village. And that is why you go to, I've been in the field. I was in the field with the Claim Your Water Right. I went to a lot of primary health care centers, and what I saw is just so bad that they don't even have equipment. It is just abandoned. They just feel that that place is just meant for bushes, meant for cobwebs and all that. If you go to some health centers in the community, you will weep. Okay, what happens to somebody that suddenly falls ill and he or she is taken to a health center? No doctor, no medical equipment, no injection, nothing. Before that person could be taken to a secondary health care center, the person will just die on the road. So because it's not pinching them, because they are not feeling the pain, that is why they will now have the mind to cut down the budget, which is supposed to even be increased, in order to improve, rehabilitate our health primary health center.
And the annoying thing there, or why people are actually concerned and speaking out and being agitated, is that it seems as if our government at the national level is not also getting their priorities right. Yes, we all know the challenge the economy has faced with respect to the COVID-19 pandemic and the dwindling revenues as a result of fall in oil prices at the international market, which has affected the economy, which even forced the government to now revise their budget downwards. But what people are saying, okay, fine, even if there are sectors that you're supposed to reduce their budget, it shouldn't be the health at a time of a pandemic of this nature, when countries are increasing their health budget. And ours, remember, part of the problem we have is the size of our country. This is a country, a nation with over 200 million people in population. That's so large, so big. And yes, we are still saying that even the initial one you had was small, and we are still reducing it by about over 40%. And you also have the confidence, the guts to still allocate about 27 billion naira for renovation of National Assembly. Where do your priority lie as a country? So which means the health of your people, the life of your people is not really that important. And even with the initial budget they did, you do know the ratio for providing basic health care to people at the primary health care centers. The ratio for every Nigeria is about 2,000 naira. In one Nigeria to 2,000 naira equivalent of health care access, which is very small. 2,000 naira, is there enough to even buy an anti-malaria drug? So you discover that our healthcare sector, especially the primary health care system, is I'm still saying that is grossly underfunded, and we should prioritize that in our budget as a country. You know, there are certain things we can do without.
Would you say that is a reason behind the strike that we see here and there backed on by health professionals?
Yes, because these people are the ones in the front line. For me, after God, the next people who help to prolong people's life and preserve people's life are the doctors and the healthcare workers. These are the people who are at the front line, ensuring that we overcome all of the health challenges we have faced as a country. I remember we've had so many health challenges. Before the COVID-19, we had the Lassa fever. We have polio. We have all kinds of communicable diseases, all kinds of diseases in our country that these people have been battling with. Then the pressure of the pandemic now came, and still you are not even paying them. Government made promises. Yes, we are going to give you hazard allowance, which is going to be 50% of your basic salary. And today, many of them say they have not gotten it. It's just a promise in the media, on paper, but in reality, they have not gotten it. And that's why you see them embarking on strike. Some of them don't even have the basic protective equipment. Because they are in the front line, anybody who is sick, who is even having COVID, and you're feeling sick, the first place you go is to where? To the hospitals. And you can see some of the things they are actually mentioning here are the primary health centers in the rural communities, because we already have community transmission. The COVID-19 thing is no more something in the cities or urban areas.
Go ahead.
I think I want to interject. See, we need to begin to ask the question about the process of procurement and delivery. Before this program, I was coming here, so I had to stop somewhere at the local Enugu South local government, because after the assessment we did, let me hear from these guys what they think. Of course I know what we found in the field, so when they are saying this, that's not true. I was told this local government here, the Enugu South local government, that the chairman, the first thing he did when this pandemic broke out was to approve money for the PPE, people to get protected. And I said, okay, the question you ask is, some of this PPE, does it get to the people who need this? You find out that, because that's why I say we need to even begin to track. If we say we are giving this nose mask, if we say we are giving palliatives, what is the process of getting down to the people who need this? I found that because what we got from the field, in some places, is that we don't have this. So, but government is saying we gave this. I was told that they approved this, and then the HOD, the supervisor, health supervisor in the same local government told me series of programs that they have, even ongoing, some coming on by Friday, what they are doing to now get the people be aware. Yes, COVID has exposed our wash facilities, the poor fund, everything about our health centers. But then I asked him a question. What is your can you say that about the compliance level of the people? He told me, we have told people to wear face masks. We have told them to make sure they sanitize. But then of course you go out there, you find them, everybody's just walking just free. So governments or the people, I agree, quite poorly underfunded. But I think the people are also a factor.
In what aspect? The process you're talking about?
The process. Okay. We must also pay attention to the process.
When you say the people, is it the citizens you are blaming now?
No. The people will now include, even because the government, for instance, the governor now approves money to give PPE for the people now. We say, take this to these people. Who is taking what? Just like the issue we are having now. Nobody is monitoring this process.
So who is responsible for ensuring that monitoring and evaluation is done?
But by the time before the government says we are taking this to the people, they are supposed to set a committee that monitors these processes. I'm not supposed to come and monitor, but then set a committee that will monitor, be sure that what you say you're giving to the people actually gets to them.
Okay, I want to say something.
Go ahead.
I don't know, when you went to the places, the health centers you went, did you see any doctor on ground? I want to ask. Did you see any?
I met one doctor, two, at Nsukka, the general hospital. Okay.
Because I know that the places I went to, I didn't see doctors there.
Which places can you mention?
I went to Onoba community. I saw nurses and then midwives there. There were no doctors there.
Did you ask?
I went to They were not on seats.
Don't you also think that it could also be as a result of the shortage?
That is the point. That is the point I want to make.
All right.
Because when you don't provide, these people are like, let me tell you, for instance, now you have a car without engine. Can you drive the car? It's not possible. Doctors are the engine of healthcare centers, of healthcare, primary healthcare facilities that we have. Without them, nothing will happen. Even if you equip it with all the equipment, without providing that necessary thing they need to protect themselves, to attend to patients, you are risking their lives. These people are the front liners in the fight against COVID-19 this period. So, but you find out that those things, the PPE, were not provided for them. I have interacted with a lot of them. Sometimes you hear in the news that these were provided. They are not so. To be sincere with you, the places I went to, I didn't see any doctor there. They will tell you that they didn't provide anything for them, and it's not lies, it's true. Do you understand? Then I interacted with some nurses there. They said the same thing. Do you know that some of them used their money to buy face masks and buckets for hand wash before the government provided the ones they provided? Do you know? Before the government made available some hand wash facilities, they have gone ahead of the government to provide those basic things for themselves with their own money. This is what we found out on ground. Nobody told us. This is what we saw.
All right, you're listening to People's Forum on 92.5 Enugu's Dream FM. Join the conversation. Now we're talking about COVID-19 and Nigeria's underfunded healthcare system. What has been your experience, especially if you're listening to us from the rural areas? What has it been like? Have you been able to find the necessary help? Do you think the facilities are there that would make things easier for you, or for you to access easily, quality health care? Talk to us on the social media platforms. The Facebook page is 925 Dream FM. The Twitter handle at Dream 925 FM. On YouTube, you can join us, watch us live. That is Dream TV Enugu. Click on the notification button and stay tuned to 92.5 Enugu Stream FM.
Hello? Hello? Is it me you're looking for?
Yes, it's you, baby.
Like the snow coming down in June, like a wedding without a groom. I'm missing you.
Miss you too, my dear.
I will cross the ocean for you. I will go and bring you the moon.
In this time of physical distancing, please don't go
I
anywhere.
wanna run to you. But if I run to you,
Nothing like that for now. In fact, the best thing you can do for me right now is to stay away.
live if living is without you. Can't give, I can't leave anymore.
We have to live, baby. We all have to live without being in the same space with each other. Physical distancing is our best form of protection from the coronavirus disease known as COVID-19. If you truly love me, you'll stay away from me for now.
Prove your love to your friends, family, and loved ones by staying away. Stay at home as much as possible. If you must go out, avoid crowds and keep a distance of at least 2 meters from the next person. Now is the time to show affection from a distance.
Amaka disappoint me. Here it
Many things they happen, oh. If you don't know, you go just suffer. Many things they happen, oh. If you don't know, you go just cry. Some community they don't get the water. Some community they don't get the school. Some community don't primary healthcare. And that is why we we follow the money. That is why we we follow the money. Join us now, make it us
with our politicians today. Nobody is making any sense.
Now only politicians, even we never show us this money.
But you
don't have good jobs. How can you?
Your views, your thoughts, your perspective. This is People's Forum.
Thank you for staying with us on People's Forum. It's 92.5 in Enugu's Dream FM. COVID-19 and Nigeria's underfunded health care systems. That's what we're talking about on the program. Join us on the social media platforms. The Facebook page, we're live on Facebook, 925 Dream FM. The Twitter handle is at Dream 925 FM. The YouTube address is Dream TV Enugu. You can follow us there and watch us live. Time in the studio is 5:34 p.m. and I have with me in the studio Dr. Daniel Ugu, Southeast Lead, Follow the Money. Mrs. Amaka Nweke is here as well, Country Programs Director, Global Society for Anti-Corruption, GSAC. Ike Nugu is here, Steering Committee Chairman of Follow the Money Enugu State Chapter. My name is Ezin Naningwe. So let's bring the people in on the program. After all, it's People's Forum. On the WhatsApp line, 0902 002095. Ugwanyi Valentine Chijoke from Nsuka. Good evening. It says the challenge of underfunding the healthcare sector in Nigeria cannot be overemphasized. Our leaders don't care whatever negative impact it has, right? Says they rely on flying abroad, but it's not been happening lately, right? For their medical attention, the medical attention they need, and you said that's why they don't care about the masses. Now that COVID-19 has trapped all of us here in Nigeria, it's a lesson to be learned by our leaders, if they will. Please follow the money, because we have excess money in this country, but our problem is the attitude, the uncaring attitude of our leaders, he says. Hello, good evening.
Hello.
Thank you for joining us. What's your name? Where are you calling from?
My name is Stanley. I'm calling from Enugu.
Stanley, go ahead.
Yeah, I just thank God for you guys that are making sure that the government, they hear this kind of thing. But the issue is that are they putting them into practice? Now, talking about underfunding and other stuff, let me be honest. Most of it is not that I know they are being underfunded, but the main truth is how they are managing it. Most times, most of our doctors, they have their own private hospitals, and those ones, they will use somebody that is not a doctor to make him a health minister. Someone that doesn't know anything about the medical line, they will make him as most of the time they just do this as they want to compensate that person. Maybe during election, the person have tried in one way or the other. They will say, okay, I promise I'll give you health minister. You find that person doesn't know anything about health. What they are thinking about is how to share money. What am I going to give you? What am I going to get from this one and that one? They don't even think that, because most of them, their children, if they are sick, they take them to abroad. Thank God for this. I'm not thanking God for the COVID-19, but I know that thing has exposed so many things. But the problem, are they ready to learn from those things? Now, I remember one of our speakers here in the studio. I thank God for them. I really thank you guys. God will bless both the female and all of you. But one of them made mention of our leaders. They want to invest so much money in rehabilitating, in maintaining our national assembly. While people are dying, there is no primary health care. And as he said, right, I've went to so many big cities, all these serious health care. They don't have any doctor, they don't have nurse, and most of those nurses, it's nurses now more. They are not those ones that even went to nursing school. They are those ones that pass out for one local hospital and stuff like that.
Okay.
Sometimes we hear that they will get somebody, whether or something will happen to that person.
These are stories, unless we get proof.
In fact, I feel like crying, because I've seen so many things.
Thank you very much.
I've seen so many people, they're not supposed to die. They die because
All right. Thank you so much. And we had to let you go so as to allow others to join the conversation on People's Forum. I believe there are many other people who have one or two things to share. Good evening. Welcome.
Hello.
Welcome. What's your name, sir? Where are you calling from?
My name is Oshipa Enugu. I'm coming from Uluyo Zoko in the South Local Government area.
Go ahead, please.
In my own opinion, the problem is the lack of technocracy. Because in a country where a legal practitioner would be appointed as a minister for health, what do you expect from him? That is the problem, or number one problem Nigeria has. Then in terms of underfunding, I may believe that, but the major problem is mismanagement of this fund, and the problem is from the hierarchy. That's from the hierarchy, because those in the hierarchy of authority, they cannot probe, they don't have that mind to probe those that are managing the health sector, because they themselves are not sanctified. When you are not sanctified, you cannot sanctify another person. You cannot prove somebody about the management of funds. Why you yourself have embezzled billions of naira? That is the problem we're having in Nigeria. Thank you. I agree on the get.
Thank you very much for joining the conversation. 0809888925 or 090200200925. Join us on People's Forum 92.5 Enugu's Dream FM. On the Facebook page, it's 925 Dream FM. The Twitter handle at Dream925 FM. On the WhatsApp line 0902000925. Welcome to People's Forum.
Hello, good evening, ma'am.
Thank you for joining us, sir. Can you be more audible? Could you be more audible, please?
Okay, this is Emmanuel. I'm calling from Suka.
Emmanuel, go ahead.
I feel very good, kudos to the guest in the studio. And the previous callers as well, because they made very vital points. One of the guests in the studio made a comment. We were talking about money to the hospital, the facility. The facility should be there. Did she make inquiry about the policies the health workers are carrying out within the facility? The funds that have been discussed, how do they manage it? And another point of mine is that when it comes to a pandemic, when we talk of pandemic, we need disease surveillance. And the people at the forefront of this pandemic issues are not just the medical doctors. Yes, because pandemic is all about public health. And when we talk of public health, to have the environmental health officers.
All right, we lost that call. Thank you for joining us, though. On the Facebook page 925 Dream FM, the Twitter handle at Dream925 FM, join the conversation. COVID-19 and Nigeria's underfunded healthcare system. That's our focus. Well, you heard the reactions we've got so far, Dr. Daniel.
Yeah, so many reactions, and I think their concerns and the issues they raise are factual, because these are citizens who are the ones who access these facilities, and they are seeing things for themselves. And I think the last caller, there's a comment he made which I also want to re-emphasize or make stronger, that yes, it's not only the doctors who are the front line workers. We have the nurses, we have other health professionals like the medical lab scientists, the caregivers, the community health extension workers, who are actually the ones in these communities providing health services and all of that. And when you look at some of them, really, like I was talking with a nurse yesterday, and she was sharing her experience with me, and I told her that why do people stress yourself so much to study such a course, and this is the way you are being treated, whether by the government. They are being poorly, for me, taken care of. That is the health workers. And we should, just like this conversation we're having, is that we're actually making a case on their behalf that government should take their matter more seriously, whether it is about making sure that there are funds available if I'm working, I should be able to work in a conducive environment. I should be able to work in an environment that is safe. Apart from the issue of welfare, apart from the issue of bonuses, allowances, and maybe life insurance that we heard that the Enugu state government gave them, what is the working condition? Do they have water to even wash their hands? You know, you see certain primary health care centers where they hang, I don't know whether you've seen such images, where they hang the drip or something would be on a wood, somebody cut out from a tree, meaning that there are no facilities, there are no beds, there are no equipment. Are they going to use their bare hands? You see some of them trying to improvise, exposing themselves to all kinds of risk in the process of doing their work.
Okay.
And these are people that have families, and they're exposing themselves to danger that may even cost them their lives, you know. And we should think about that. And, you know, just like somebody pointed out, this pandemic, you know, the chicken now came home to roast, because everybody now have to be in the country. Nobody is traveling.
Exactly.
And the secretary to the government of the federation made one interesting comment. He said that this pandemic was now what opened up his eyes to see how dilapidated and weak and poor our healthcare system.
So now that we know we're looking for the way out, Mrs. Amaka, what are you saying that should be done moving forward?
What I'm suggesting is the rehabilitation of all the primary health care centers. Let them make sure that the wash facilities are available. Provide water for the health care centers. Provides good sanitation, because some of these health care centers, they don't even have good toilets. Somebody will be sick, you will go to the hospital to get cured, you will contract another
infection. Yeah.
It's a very big challenge, it's a very big problem. Then the hand wash facilities should be there too. Then again, the instrument that the doctors need to work with. Sometimes you go there, they will tell you there is no syringe. Oh, madam, go and buy syringe. It's not supposed to be. How much is syringe? These are the things that the government should provide, because this primary health care center is the main, I don't know how to put it, is the first point of contact for those in the community. If these things are taken care of, the high rate of mortality will reduce.
Yeah.
Because take for instance somebody who is very sick, he's not breathing fine, and they rushed him to a health center. There is no oxygen, nothing to just resuscitate the person, you know. Maybe before doctor will now come and attend the person. Then before they will now transport the person from one village, one health center in the village to maybe Park Lane, the person will just die on the way. People die when they are not even supposed to die, because the basic things we need are not there. These people are important. Lives are precious. So I'm calling on the government to do something. Though Enugu state government has flagged out rehabilitation of about 34 health centers. Yes, we say kudos to that.
Yeah.
And they want to construct new health centers, about 7 in some communities.
Yeah.
So it's a very welcome, you know, development. We
Let's see
thank
who
them.
we have here. Hello, good evening. Welcome. Thank you for joining us.
Good evening to the guests in the studio. My name is Stephen Bami. Every day you see the reason why some of us complain, and some people will feel bad that why are we complaining? Now, let me talk about cutting down the budget that is being made for health sector. Before this time, the budget for funding for the health sector has been so poor, and for you to now go and cut it down, look at it. The government is not telling us that if someone is having sickness and they go to the hospital, he cannot get full treatment. The treatment will be halfway. Look at how the doctors go on strike. Our health sector is in a mess. You go to some clinic in some community, you only see a doctor there. Is it right to have a single doctor in the hospital when the doctor might have other things to do, and when the patient comes to the hospital, they will not see doctor. They say doctor is not around. It's very bad. Okay, I want to ask the crusader for corruption there. Have you asked the so-called lawmakers, the honorables, have they cut anything down from their allowances, the bogus allowances that they are taking? Why not cut it down from that instead of cutting down from the health sector? This has shown that the leaders of this country did not love the masses. It is a clear thing. It's a clear evidence. It's very bad.
Thank you.
It's terrible.
Thank you very much. Thank you.
Stephen.
Thank you, Stephen Bami, for your submission. Finally, as a round of Ikenna,
Isn't it, you see, you can hear the people's voice. I think that is the people's voice, and you can, from there, you can see that everybody's angry. Everybody's angry. I'll show you something. I got this picture when I went to this place. This is what they use to collect water for a healthcare center. Okay, these ones are just what you have. My addition to what we have said here is this: cut the money, add to the money. I think we have an issue with management, because even if they increase the budget now, I guarantee you, if you don't get the maintenance culture right, this place I went, look at this, everything is dry. They have the facilities, but none is functional. So while we budget, while we add or reduce, we must make sure that these ones we have on ground are working.
so you're calling for the maintenance culture.
Yes.
The maintenance
I tell you,
culture.
even though they cut what we have now, if we can manage well what we have, it may not be enough, but we won't be where we are. We won't be where we are. So
All right.
the culture of maintenance has to come in. We need to take care of that.
Dr. Daniel, finally, as we round off.
Yeah, it's been an interesting conversation, and I want to say that still our government needs to get their priorities right. Let's prioritize health, in our spending, because when you take a look at budgets, whether it is at the national level or at the state level, you realize that bulk of the money go into recurrent expenditure on personnel, paying salary, all the things accruing to them as people in government, overhead, and so on and so forth. And very little is now remaining to tackle mainstream issues, and health is one of them, a priority. So I think the government needs to really, whether it's going to be reform or, seeing that health is wealth. In fact, if the people are not healthy, how are you going to build the economy? So we should prioritize our health sector and begin to fund them adequately and put mechanism for checking corruption and making sure that things work effectively.
So
and
how does follow the money? How does follow the money come into this whole?
We just keep advocating. That's where we come in, because part of our work is also to advocate for increased funding for health, which is a major cardinal sector for our advocacy, and also to see that the money and the funds that are being released for building health facilities and maintaining our health sector, that this money actually are used for the purpose for which they are budgeted for and they are released for. This is part of what we do. We track, to ensure that, yes, as government is saying that they are building how many healthcare centers in 17 local governments.
All right.
We also go to check. So that is it. And again, I also want to to appreciate the people who supported this program. This program is actually brought our way by Connected Development with support from Oxfam Nigeria. They actually made this possible. I want to say a big thank you to them, even as a roundup.
All right. And your social media platforms?
Yes, and we also want to encourage the citizen to speak out. Speak out. You can actually make use of your social media platform. You can follow us on our Follow the Money handle on Twitter, which is 4LL Follow the Money on Twitter. On Facebook, Follow the Money. Look out for Follow the Money on Facebook. If you have issues in your community you've identified, you can actually write about them and tag us, whether on Twitter, on Facebook, on LinkedIn, anywhere, and we'll help you to amplify. And again, this is also a call for the citizens, because we need to also push this advocacy beyond what we're doing here.
Very
we need
well
to
then.
now begin to make demands, whether on social media, whether in writing, begin to ask government to do something as far as the health sector is concerned.
Thank you so much, gentlemen, lady and gentlemen, for coming on People's Forum. Mrs. Amaka Nweke, Country Programs Director, Global Society for Anti-Corruption, GSAC. Thank you for coming today.
Thank you.
And thank you for coming, Dr. Daniel, who is the Southeast Lead. Follow the Money. It's been a pleasure having you.
Yeah, thank you, Zine, for having me.
Also, thank you to Iken Naugo, Steering Committee Chairman, Follow the Money, Enugu State Chapter. It's been a pleasure having you as
Thank you so much for having us.
Thank you for your calls and your contributions on the social media platforms. A big thank you to Alex Obodo for making sure that we streamed live on Facebook. Go to YouTube, find us, Dream TV Enugu. You should do that. Find us there. click on the notification button after you like whatever content we post there for you to enjoy. And a big thank you to my producer, OK Odogu. My name is Ezin Naningwe. Stay for Sportian with Frankie on 92.5 Enugu's Dream FM. And till I come your way again, be good, do good. Deborah Mba will be here for People's Forum tomorrow 5 p.m. Stay with us.
Dinner is served correct goat meat pepper soup.